Hi, my name is Andrew McKendrick. I'm 35 and I have liver disease. I live in Guelph, Ontario, Canada, and tonight I want to share with you the outrage that I experienced in a recent visit to the Guelph Hospital Emergency Room. I'm not saying that every experience to the Guelph Hospital Emergency Room is a bad one, but this is my story, and this is what I experienced. My story begins days earlier, on Sunday, August 22nd. A friend of mine forced me to the emergency room at a hospital in the nearby city of Kitchener as I was feeling extremely nauseated. And they were worried about me. Days earlier, I had just finished a course of 24 days of antibiotics for an E. coli and ear infection. Among the medications prescribed to my doctor, which are all right here, were Suprax, 400 milligrams for 7 days, Sulfatrim, 960 milligrams for 17 days, azithromycin, 1 gram, 1 dose, and up to 3 Tylenol and 4 Advil per day for pain, the fevers I was experiencing, and for the persistent headache that I had. Blood tests were conducted, and it was determined that my liver function was, and I quote, at the upper range of normal. I was released without being admitted to the hospital. I also want to say that my blood tests conducted prior to starting the course of these antibiotics were, as my doctor put it, better than normal. And those blood tests included my liver function and my nutrition levels. On Tuesday, August 24th, before going to bed, a few hives appeared on my abdomen. Now, I know what a hive is because, just like millions of other people, I have allergies, and occasionally when exposed to an allergen such as cat dander or Tide detergent, I get them. The worst case was when I was 22 years old. I slept over at a friend's house who used Tide detergent, and my back the next morning was covered with a rash of hives, completely covered, pimples and hives. So the next morning, at Wednesday at 1 a.m., I awoke with a rash covering my entire arms and my upper legs. And they were covered with hives and pimples, just like sandpaper. And it was burning like fire. It was absolutely burning. Now, I will admit I was scared. I mean, when you're not feeling well and you wake up with something that you've never experienced before and you don't know what's happening to you, it's scary. I called a friend very quickly to sort of say, look what's happening to me, I'm scared, I think I'm going to call 911. And I did. I called 911. The ambulance came within about 10 minutes. And that wait was horrible. I mean, I was worried about my breathing. I didn't know what was happening to me. Now, I was wearing my underwear, having just woken up. And the paramedic, when they came in, they saw me, and they agreed that it looked like an allergic reaction. I mean, I had a rash everywhere. He took my blood pressure, and he did not administer any kind of antihistamine or any adrenaline injections. They were wonderful, by the way. The Guelph ambulance was wonderful. The ambulance arrived at Guelph Hospital Emergency Room, and there was a woman with two children, a security guard present, and a woman in the registration triage area. And I'm going to call her a woman, not a nurse, for a particular reason, which we'll get to later. The ambulance personnel left me with this woman. She took my name and address, but she did not look at my rash. I had some clothing on. The ambulance driver told me to throw something on. I had something right near the door I could throw on. She did not look at my rash. She did not take my vitals. That means my blood temperature or my blood pressure or my temperature. And she essentially told me to wait in the emergency waiting area. The woman with the 2 children were called into the secure area, the emergency room itself, and I was often left alone. I mean, the security guard would frequently go on rounds, and the woman in the triage would leave for these extended periods of time, like maybe 15 minutes or 10 minutes, and it was scary. I mean, I felt absolutely abandoned. And no one checked my condition for about an hour that I was waiting there. I mean, how is it possible that someone calls 911 and the paramedic agreed that you have some condition, and anyone who's had an allergic reaction knows that allergic reactions can be serious. I mean, you can have anaphylactic shock or something can happen to you. And the triage doesn't even look at it or even assess your condition in the entire hour that you're waiting there. And in my opinion, that's the first failure that I experienced. Now, when I saw this woman again, I asked her, whether I could have something to drink. My mouth was getting very dry. My throat was very dry. And she said to me, I am not a nurse, and I'll have to check whether you can drink anything. And this is the second failure. So at this point, the woman in the triage was not even a nurse by her own admission. I mean, did she even know how to check vitals? I was very uncomfortable at this point. I mean, any kind of comfort that I had just flew out the window. I was actually safer in the ambulance with the paramedics who had medical training, and when I asked her why nothing was being done, she said that there were no beds available. And this is the third failure. I mean, you call 911, an ambulance takes you to the nearest hospital where you're essentially left there in this place, and no one does anything while you wait for a bed. I mean, if I was there for 3 hours in that waiting room, are you telling me that no one would have looked for me in 3 hours? I mean, I was there for about an hour inside the waiting room, at least maybe even longer than that actually, but that's what I felt. So I don't need a bed at that point. I need a doctor or nurse to look at me and assess my condition. And I actually felt at this point that this couldn't be real. This couldn't be happening. I felt like I was in a dream sequence. But then I'm just trying to convince myself that no, this really is actually happening to me. That this is not a dream sequence. And if you've ever seen the movie Halloween 2, and you see Laurie Strode in this empty, abandoned hospital, that was me. And this condition was like Michael Myers, and it's stalking you. And it's absolutely terrifying at this point. You don't know what's happening to you, and you're terrified. I mean, I'm human, I have feelings, and I'm terrified, and there's no one giving me any kind of comfort at this point. It's probably about 2 o'clock in the morning. I'm terrified. Now, an hour passed, and this woman called me into the actual emergency room, or some woman called me into the actual emergency room. And she told me to sit on a stretcher in the hallway. And then she left. So there's this hallway in the hospital as soon as you come through the doors, and there's stretchers there, and I was sitting on one stretcher. There was a woman sitting on another stretcher near me, and there was no one else around. And I was kind of tired, so I laid down. And I just tried to relax and just feel better. But then I needed to pee, like pretty much within 5 minutes. So I got up and I started looking around. I couldn't really see any signs saying that there's a washroom. And I just started to heave, just like you're going to vomit, but you're not actually vomiting. And out of the corner of my eye, I saw this doctor standing there, and he wasn't even looking in my direction. It turns out this is actually the same doctor later on that actually looked at me. And another patient, this other person that was sitting on a gurney, she went around the hallway and called out to some nurses and said, there's someone here that needs your help. And they came, and I tried to vomit in a garbage can, but the nurse took me into the washroom. And I wasn't actually vomiting at this point, I was just heaving. And then I started to vomit in the toilet. And then she said to me, you need to get off the floor. You know, the floor is not clean. You really need to get off the floor. That's pretty much verbatim for what she said. And I think it's very natural for someone when they're vomiting to get down on their knees and put their head over the toilet and try to vomit. And I think the least concern that I have at this point is whether the floors are clean. And I mean, I don't care if it's not clean. So, I don't know. Everything was very cold in this hospital. And I want to state that I had not vomited for 10 years prior to this night. I have a strong stomach. I do not vomit. And so here I am vomiting for the first time in 10 years. And I said to her, when is someone going to look at me? I mean, here I am, I have this rash, and now I'm vomiting. And she never said anything. She just took me, gave me a vomit bag, put me in an empty room, and closed the curtain behind me. And there was actually an empty room with a stretcher in it, and I laid down the stretcher, and I continued vomiting. And I remained in this room alone, lying on this bed. No one checked my vitals or anything. A friend of mine came, and I was freezing cold. And they asked a nurse for several blankets, and I was still cold. And this is the fourth failure. I mean, my condition is deteriorating. I was cold, possibly had a fever. I was vomiting now, and no one was doing anything. Maybe about 30 minutes after my friend got there, a doctor came into the room, and I told him everything. I told him everything from the beginning, from Kitchener Hospital, going forward to the antibiotics I was on. I had brought all of the slips with me. While I was waiting for 911, I grabbed all of my medical slips for the prescriptions I was taking. I thought of that because I was afraid that it was some reaction to the drugs that I was taking. I was worried about that. I've never had any reactions in the past, but who knows? And I told him everything, and he said to me, I told him about having blood tests at Kitchener, and he had me sign this request form to get the results from Kitchener, and he stated that they would not perform any additional blood tests on me in Guelph that night. Now, he went away and came back around 5 a.m. with the results. And he looked at my arms and legs at that point. My friend stepped out. He looked at my arms and legs, but the rash was gone. I mean, I had like little red dots, but, he didn't see anything. And he said that. I don't see any rash on you. And I was shaking. I was freezing cold. And he asked me, why are you shaking? And I told him, I said, I'm cold. He never looked at my vitals again. No blood pressure, no temperature, nothing. No one did that from the entire time I came into the hospital. And he proceeded to tell me that I was just experiencing a little anxiety. And he prescribed me 10 lorazepam tablets, which I aptly call happy pills because they essentially make you calmer and make you want to sleep. They're highly addictive, by the way. He gave me one in the hospital, and he gave me a prescription which I filled pretty much immediately the next morning. It was almost morning by the time I was released. And this was the fifth failure, in my opinion. Don't you just hate these doctors who make it sound like you have some psychosomatic condition and yet they do nothing absolutely scientific to come to their conclusion? And you'd think that this was the end, and it's not. My condition continued to deteriorate. The vomiting continued. The nausea worsened. I started becoming very tired. Even when I was just walking, it made me tired. My stools turned white. My urine became like dark Tetley tea, orange-brown urine. My skin became very itchy all over my body. My eye whites turned yellow, essentially symptoms that are very much in line with jaundice and liver disease. Another friend of mine, in conjunction with this other friend who was getting worried about my condition, took me to Toronto General Hospital. This is a good hospital, by the way, where I was admitted, and they kept me there for 3 days. I was told by a doctor that my liver function, after going through and explaining to her all the things that had happened to me, she said that it was not just at the higher end of normal, mocking the other hospitals, and told me that they should have kept me at those hospitals to monitor my condition. My liver function numbers, which I have right here, and I'm going to tell you, I'm going to give you my personal information here. My AST on admittance to the hospital was 217 units per liter. My ALT was 599 units per liter. My ALP was 324 units per liter. And my total bilirubin was 88 micromoles per liter. All of these numbers are well above normal. So I believe, and this is my opinion, my personal opinion, that Guelph Hospital and any hospital in general should have a qualified nurse in the triage area at all times. They should check your vitals periodically on anyone in the emergency room, whether you're in a room with the curtain closed or whether in the waiting room. They should ensure that all patients within the emergency waiting area are periodically assessed to ensure that their condition is not worsening. They should conduct their own blood tests when they are warranted. In this case, I believe that they were warranted. I gave them a good reason. It could have been hepatitis. It could have been anything at that point. They should have conducted their own blood tests, not just relying on what was done 2 days ago at another hospital. Obviously, something was wrong. Doctors within an emergency room must base their medical conclusions on scientific evidence, not just simply assigning some psychosomatic diagnosis to their patients. Oh, I'm sorry, but you're just panicking, or you're just having a lot of anxiety, and so here's some happy pills. Take these and see if you get better.